The Catechism of the Catholic Church affirms the use of a homosexual identity, stating that homosexual persons are called to chastity. It exercises deference to scientific findings, noting that the pathological genesis of homosexuality remains largely unexplained. Research affirms the Church's restraint, documenting the inefficacy of conversion therapy, and that conversion therapy nearly doubles the risk of suicide for lesbian, gay, and bisexual people. Catholics might be surprised to find, then, that the United States Conference of Catholic Bishops is currently defending conversion therapy in the U.S. Supreme Court. Adherents of conversion therapy, which pathologizes homosexuality as a result of childhood trauma or socio-emotional wounds, allege that the modality can increase heterosexual desires and identities and decrease homosexual ones. Catholics such as Joseph Nicolosi Jr., Bob Schutz of the John Paul II Healing Center, Christopher West, and Andy Comiskey of Desert Streams all promote some form of this approach. Mary Rice Hassan of the Person and Identity Project endorses it for transgender and non-binary identities as well. In 2019, Colorado joined more than 20 states in passing the Minor Conversion Therapy Law. The law prohibits licensed mental health professionals from engaging in any practice that attempts or purports to change an individual's sexual orientation or gender identity. Its application is limited to minors and does not prohibit conversion therapy by religious leaders or professionals acting outside of the scope of their licenses. A Christian therapist sued to overturn the MCTL, arguing that it violates her First Amendment rights. The U.S. Conference of Catholic Bishops, along with the Colorado Catholic Conference and the Catholic University of America, filed a brief opposing the conversion therapy ban at the Supreme Court. The brief correctly argues that questions of gender and sexuality are fundamental and enduring questions about human existence, and that people need the freedom to seek guidance from others who share their values. But in stating that this case addresses a timeless and nearly universal human experience, seeking counsel from a trusted advisor to discern right from wrong in confusing or complex situations, the brief mistakes the role of the licensed mental health professional. The Archdiocese of Indianapolis offers a helpful distinction between spiritual direction and psychological counseling in its guidelines for spiritual direction. Psychological counseling focuses on developing tools and life changes to improve daily functioning, while spiritual direction is a process of seeking to understand and follow God's will. Theologians and ministers help with moral and vocational discernment. Licensed therapists use professional best practices to pursue psychological goals. Thomas Plant in the Journal of the Catholic Psychotherapy Association says, quote, "Boundary crossings may also occur when a Catholic therapist weighs in on theological matters and beliefs outside of their area of professional competence and licensure. They may integrate their personal beliefs and practices into their professional work in a way that is inappropriate, unprofessional, unethical, and potentially exploitative. To avoid these problems or temptations, Catholic psychotherapists may encourage their Catholic clients to receive ongoing and separate consultation with a spiritual director, cleric, or other appropriate representative within the Church." Further, the U.S. Conference of Catholic Bishops argues that the government may not regulate content when therapists are talking with their clients. It acknowledges that talking is the only relevant service that the therapist proposes to provide. In this, the Catholic bishops are essentially arguing that these paid licensed services should not be regulated at all. This is an extraordinary claim and is inconsistent with a properly Catholic understanding of religious liberty. Dignitas Humanae, the Second Vatican Council's Declaration on Religious Freedom, argues that society has the right to defend itself against possible abuses committed on the pretext of religion. It warns against the dangers of an unbridled false religious liberty and argues that defense against this is the special duty of government. The Catholic Bishops' brief waves away this Catholic teaching and instead adopts a contemporary American understanding of liberty, one in which rights are absolute. It harkens to past arguments by the U.S. bishops that the Church ought to be immune from liability for clerical abuse in the name of religious liberty. The U.S. bishops' defense of conversion therapy in the name of freedom is an ecclesial scandal and makes our Church's leadership a party to serious harms. Contrary to the Catholic bishops, former leaders from ex-gay organizations are supporting the ban, including founders and leaders from Exodus International, the world's largest ex-gay ministry until it sought accountability for the lives it harmed and shut down in 2012. In their brief defending the ban, those former leaders note that they built the field of conversion therapy programs, that they can't take back the harms that they caused, and that they now have a moral responsibility to prevent future damage. Another brief supporting the ban was submitted by a group of mental health professionals who identify as theologically orthodox Christians. They argue that the ban is limited in scope and protects the First Amendment rights of Christian professionals and their clients. One day, the U.S. bishops may find their way back to church teaching, to a respect for professional boundaries, to pastoral care for the vulnerable, and to accountability for their failures. But in the meantime, LGBTQ+ Catholics may need to look elsewhere for leadership.